Good morning, I'm Rosalie, and today we're featuring healthcare experts with advice to capture real-life solutions to real-life concerns, from nurturing parents to informative seniors. So now, get ready to get inspired to kick off a healthy weekend. If you're one of the millions of moms suffering from fever phobia, and being terribly worried about your child having a fever, you're not alone. According to a recent survey conducted by Braun Thermometers, 82% of moms surveyed believe fevers can cause brain damage. Joining us this morning to calm parents' fears is Dr. Deborah Gilboa, an internationally respected family physician, parenting expert, and founder of AskDoctor.com. Good morning, Dr. G.
Good morning, Rosalie.
Every parent fears that their child could have brain damage. As a parent of a child with autism, I understand those fears, mostly if it is caused by a fever. So tell us, doctor, if you were to counsel parents to calm their fears of the fever, how would you explain the most accurate process of taking your child's temperature?
Rosalie, you're so right. It's easy to feel afraid of a high temperature, but almost always, that's a safe, good thing that your child's body is doing to fight off the infection that it's faced with. The most accurate way for parents to know exactly how high is this fever is to check in the ear canal at home. That's because the tympanic membrane, the eardrum, shares the same blood supply as the temperature control center in the brain. So you know if you use Braun's ear thermometer that you're getting a really professionally accurate reading in a way that's comfortable for your child.
The survey also found that 4 out of 10 moms believe that using the back of their hand on their child's forehead is a good way to determine if they're hot and have a fever. I must admit, I still do that today to my son and even to my husband.
And you know what? It's a really good way to make our kids feel like we care about them and we're connected to them, but it's a terribly unreliable way to check a temperature.
So it's an old fallacy, right?
Right. It really does feel nice, but it depends on so many environmental factors, the temperature of your skin, the air around you, what your child was just doing, that really to get the peace of mind of knowing I do know if my child has a fever and how high it is, we really do have to put that thermometer in their ear and check.
So how about if a child or an adult says they feel hot? How accurate is that?
It's incredibly important for our kids to know how to advocate for themselves and describe what they're feeling in their body, especially if they don't feel well. But feeling hot on the inside isn't a good indicator from a child or an adult to know if they have a clinical fever. So go ahead and listen to them and respect that, but also check.
All right, Dr. G, tell us more about the results survey found. Like 82% of moms believe a fever can cause brain damage in the child. Can fevers cause brain damage?
Almost never. So what's really important is to look at the whole child. So you've tested their temperature in their ear and you know exactly what that number is, but also, are they drinking? Are they playful? Are they sluggish laying on the couch, don't want to move? Do they also complain of pain anywhere? How has their eating been in the last day or so? When you look at your whole child and you feel worried, that's the time to reach out to their caregiver. Never worry that you're going to call your child's doctor's office and they're going to say, you shouldn't have called us. We never say that. What we want to know is if you're worried, you know you can reach out and ask the questions you need to ask.
The survey also reported half of moms wake their child in the middle of the night to give them fever-reducing medication. Is that needed, or is sleep better for a child?
Sleep is really good for healing. It's so important to know that if your child had a fever during the day, and this is what really happens, Rosalie, right? You can't sleep because you're so worried that your child is in their bed getting sicker and you don't know it. I understand the need to be able to monitor their fever, and that's important. Go ahead and use something like Braun's no-touch forehead thermometer so that you can know what their temperature is without waking them. It's almost never necessary to wake them up.
What other tips, Dr. G, can you offer parents when they're worried about their child with a fever?
I actually really want parents to recognize that although it can be frustrating or scary when our kids get sick, and I have 4 kids and I sometimes feel like, oh my gosh, one of them is always sick, It's also a great opportunity to not only show them how much we love them and care about them and form that connection when they're not feeling well, it's also a great time to teach them how to start taking care of themselves, how to speak up when they don't feel well, describe what's going on in their body, communicate what they need, and this is just a tip for moms, don't let them get away with really bad behavior because they're not feeling well. It's okay to say to your child, I know you feel sick, but you still can't speak disrespectfully to me or be mean to your brother. You still have to be a good kid.
All right, and you know why I always wanted my son to eat when he had a fever? Is that the right thing to do to make sure your child is eating healthy to fight off a fever?
So eating is useful all the time, but if you're not feeling well, I mean, Rosalie, when you're sick, you often probably don't feel hungry either. Kids don't always have to eat, but they always have to drink. So it is important with a child to keep track to make sure they're drinking enough. And by enough, I mean, are they urinating regularly? And if they're not, if they haven't had wet diapers or you haven't noticed them going in to pee, with older kids, you can say, hey, because you're sick, I need you to let me know when you're using the bathroom so that I know you're staying hydrated.
Thank you so much for joining us, Dr. G, this morning and educating our viewers to the most accurate way to check your child's temperature and calm the fears of worried parents.
Thank you.
The evolution of affordable health care throughout the U.S. continues to increase in cost instead of going down as planned. Though healthcare professionals in 24 states now offer a new model to patients that will access quality healthcare at a more affordable cost. This model is called direct primary care, and it offers primary care services at a fixed monthly rate in the form of a contract between a patient and a physician provider. Joining us to explain how it can benefit patients with high health insurance deductibles or no insurance at all is healthcare professional Joseph DeCapua. Good morning, Joseph.
Good morning, Rosalie. How are you doing?
I'm fine, thank you. Okay, so Joseph, tell us, is direct primary care a form of insurance?
No, Rosalie. Direct primary care is not a form of insurance. There's a distinct difference between the two. One is health insurance, which is through a company, for example, Aetna, Humana, Coventry. That's health insurance where the plan offers all the services, medical services that you would need to be covered. Hospitalization, specialists, diagnostics, lab, rehab, pharmacy, so all those are covered underneath health insurance. Direct primary care is based on a membership format whereupon a patient and a doctor, primary care doctor, sits down and they contract services.
All right, so what's the distinction between healthcare insurance and direct primary care?
A hospital is not covered under direct primary care. The doctor offers a list of primary care services that the patient would receive for a fixed amount, monthly amount, which is usually between, depending on the age, $45 to $125 per month.
So if a person cannot afford health insurance, will direct primary care provide services that most healthcare insurance policies offer?
Direct primary care only offers primary care services, and people have to remember that 70 to 80% of their medical needs can be met by a primary care physician. A hospital is not covered under direct primary care.
All right, let's say a patient falls ill on a Saturday night. Can they rush to an emergency room since the direct primary care doctor's office is closed?
A patient that has health insurance can go to the ER if they want. Someone with direct primary care would call the doctor, and the doctor will then assess over the phone what could be done, whether the patient should go to an urgent care center or to the ER.
So Joseph, explain, how does the patient-doctor relationship through direct primary care work?
The patient comes in, they speak to the physician, they sit down, and the physician then takes out the contract, and they go over the services that are offered underneath this membership agreement. And when the patient decides that, yes, they want to become a member, they then sign up. Usually there's a processing fee. It depends, anywhere from $25 to $75, a one-time processing fee. And then there is the membership fee, that's a monthly fee. And again, that is age-related in age ranges. Most doctors do not see Medicare because they do not want to, what we call, opt out of the Medicare program. The program for direct primary care usually stops at people at age 64. One of the benefits of direct primary care for seniors is that usually when the spouse hits 65 and becomes Medicare eligible, that person's spouse does not have insurance and loses insurance. Using direct primary care, they're able to get some type of health care.
If a single mother with 3 children cannot afford health insurance for her family, is there a direct primary care family plan membership available?
Yes, there is. And it depends on the direct primary care practice that you go to. Some practices have pediatricians or family physicians that would see newborns and up, but most of the practices for primary care have family practitioners that will see from 16 and up, or internal medicine doctors that will see from 18 and up. So the answer to that is it depends on the direct primary care practice itself.
So how about small businesses who need to offer their employees some form of health care services?
This is an excellent product for businesses, especially small businesses that the cost of healthcare is crippling. The company usually buys the hospital confinement part of the policy so that the employee has primary care services, so they have access to health care, and have hospitalization in case of an emergency. And it's a very good product, and it helps employers reduce their costs, but also, which is important, retention, employee retention.
Thank you, Joseph, for joining us this morning with options to an affordable new healthcare model for those who may not have healthcare coverage and need access to primary care doctors.
Thank you, Rosalie. I appreciate it.
Being in good health can be your greatest asset in life. But if you're one of over 15 million Americans living with COPD, you're at a greater risk to contract a lung disease called non-tuberculous mycobacteria, or NTM. We all come in contact with mycobacteria. It's found in tap water, shower heads, steam from hot tubs, and soil from parks and gardens, and some domestic and wild animals. For some people, there's no effect, but that's not the case for those with COPD. Here to educate us to NTM lung disease and its risk to patients with COPD is Dr. Shannon Kasserbauer, an infectious disease physician at National Jewish Health and assistant professor in the Division of Mycobacteriology and Respiratory Infections at the University of Colorado School of Medicine. Good morning, doctor.
Good morning.
All right, doctor, so tell us, what is the definition of COPD and the cause of this chronic condition?
Yeah, COPD stands for a chronic obstructive pulmonary disease. And a lot of people think about that as it relates to smoking history, emphysema, or asthma, and even a cause called bronchiectasis, which is a chronic damage to the airways. NTM lung disease, as you said, stands for non-tuberculous mycobacteria. So these are germs that are found everywhere in our environment. We all inhale them every day, and certain people are at greater risk of developing a progressive chronic infection related to NTM. So we know that there's at least 86,000 cases of NTM lung disease in the U.S., and that rate is increasing by 8% per year.
So everyone comes into contact with NTM bacteria during their daily lives. However, not everyone is at risk of getting NTM. What populations are at most risk?
And people with COPD are certainly at greater risk, but really any underlying lung condition where you have difficulty clearing the bacteria from your lungs because of airway damage. Other people that are at risk include those that have compromised immune systems. We know that people that are older, so over the age of 65, is an important risk factor. Women are disproportionately affected compared to men. And then important for your viewers, people that live in the coastal parts of the U.S. are at increased risk. So those people make up 7 out of 10 cases of NTM lung disease.
So if you love gardening like I do, that simple activity will put you more at risk to microbacteria because it's in the soil?
Yep, that is true. Yep, so the germs are aerosolized. And again, we all probably come into contact with these on a daily basis. So it's important to understand that there's something about the host that allows people to get NTM lung disease, like those risk factor conditions that I just noted.
All right, so doctor, tell us, how important is it to get tested for NTM lung disease?
People can develop chronic, permanent damage to their lungs if they're not diagnosed properly and treated. And because a lot of these symptoms that I just talked about mimic other lung conditions, delays in diagnosis are very common. So we have patients that, frequently have gone on with symptoms for months and even years before they're ultimately diagnosed.
All right, so how can non-tuberculous mycobacteria be treated?
In general terms, we treat this infection with a cocktail of antibiotics, and that regimen lasts several months. And the whole goal of treatment is to be able to take someone's sputum cultures, which is an important part of the diagnosis, is being able to culture this from your sputum and making those sputum cultures negative, meaning that we can't find the bacteria in their lungs any longer.
All right, so tell us where our viewers can learn more.
There's 2 important websites that I would like them to explore. And the first one is aboutntm.com. And that website gives them a lot more resources on NTM lung disease, but also helps them frame a discussion to start talking to their provider if they're concerned that they or one of their loved ones might be struggling with some of these symptoms. The other website is ntminfo.org. And that website is actually an incredible tool for connecting patients with other people that struggle with NTM lung disease, either through an online community or local support groups in their area.
Thank you, Dr. Kasserbauer, for joining us this morning to educate our viewers to the risk of non-tuberculous mycobacteria that's living in and around our water and our air.
Thank you.
And now we're talking talent, real talent. R&B music icon Patti LaBelle has a new attitude these days. Patti's career spans over 50 years as an entertainer, author, and entrepreneur. Now the godmother of soul is trying her hand out at jazz with a new album, while lending her voice to a campaign to empower fellow baby boomers to get a new attitude about their health. Joining us to discuss her ventures and the new awareness effort is the outstanding, talented Patti LaBelle and Dr. Vincenza Snow, general internist with special interest in adult immunization. Dr. Snow is the senior medical director for Pfizer Vaccines. Good morning, Doctor and Patti.
Good morning, Rose.
Patti, you are amazing. You are doing a number of things. You've got some energy, huh? So you're not getting older, you're getting better. So why did you decide to branch out into jazz? And what other projects are you working on these days to keep you busy?
Okay, that was a 10-year process, thinking about doing jazz music. I was afraid to try it because I've never done it before. And then my ex-husband kept begging and begging and begging. I said, okay. So it's done now, Rose, and I love it, you know, and it's in stores now, and it's doing quite well. And I also have this diet, I'm sorry, it's not a diet cookbook. It's a cookbook for people who don't want to be on a diet. It's all sweets, desserts, 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 okay? But I have some diet ones back in the day, some of those also. But that's out. I have a 3rd season for my Cooking Network show on the Cooking Channel. It's called Patty's Place. That's coming out at the end of this year. I never stopped touring, and I'll be working for the rest of my life. And, you know, I'm here now, and I'm strong, and I'm here for Pfizer, you know, speaking about pneumococcal pneumonia and how when I got my life scare, we talked about my diabetes before, you and I. It started me looking at doctors and taking care of Patty more so than I used to. And so now with the pneumococcal pneumonia, it's all over, but we as 65 and older, we don't realize that we can be vaccinated for this and save our lives and stay young and healthy and all those beautiful things. And we have a campaign called, you know, allaboutyourboom.com. And there's a lot that's going on. And Dr. Snow, as you see her with me, she can give you a lot more information than I could about it.
Dr. Snow, Florida has a tremendous amount of seniors. And according to the Florida Department of Elder Affairs, nearly 5.2 million residents are age 60 or older. And Florida ranks first in the nation for 65 population and up. So what advice would you give our viewers nationally who think they're healthy and not at risk for pneumococcal pneumonia?
So it's important that they know that pneumococcal pneumonia is a potentially serious bacterial infection of the lungs. And if you're 65 or older, even if you're healthy, you're at higher risk for getting pneumococcal pneumonia. And in fact, you're 13 times more likely to be hospitalized for pneumococcal pneumonia if you're 65 or older versus someone who's 50 or even younger. So it's important for you to talk to your doctor or your pharmacist to make sure you're up to date with all your immunizations.
The Centers for Disease Control estimate about 900,000 Americans get pneumococcal pneumonia each year, and about 5.7% die from it. How is pneumococcal pneumonia different from a common cold or flu?
So the common cold or flu are caused by viruses, and pneumococcal pneumonia is caused by a bacteria called Streptococcus pneumonia. And luckily, we have vaccines that can help prevent all of these infections. So it's important for you to make sure you're up to date with your vaccinations, especially if you're 65 or over. And you want to keep your all about your boom and just be like Patty and be vibrant and working and doing everything that you want to be able to do.
So, doctor, can pneumococcal pneumonia hit the most healthy and active older adults, even if they're healthy and vibrant, like Patty?
Absolutely. As I was saying, even if you're perfectly healthy, you are still vulnerable to get pneumococcal pneumonia. So it's always important. I always say prevention is better than treatment, and it's always best if you speak to your doctor or pharmacist to make sure you're up to date on all of your immunizations.
All right, so what population do you think is the most vulnerable for the common cold and flu?
So for all infectious diseases, persons over 65 or older, unfortunately, as we age, our immune system ages as well, and that makes you more vulnerable to infections. And then also people who have some chronic diseases, either immunosuppression, like HIV or cancer, or chronic diseases like diabetes, like Patty, or chronic heart disease, lung disease, kidney disease. All of those things can make you more vulnerable to getting these infections. So again, it's important to always make sure you're up to date with all the appropriate vaccinations for either your age or if you have any of these conditions.
So Patty, when you're on the road touring and enjoying your work, are you sharing your message with others on how to take care of themselves?
Oh, I do it all the time. You know, I perform constantly. And in my show, I always talk about my menopause, my diabetes, and how fierce I am, you know, at 73, and telling them how when I took the chance to go on Dance with the Stars at 71, you know, as far as I'm concerned, I did 6 weeks, so I'm a winner. And there's so many people over 50 who think it's over for them for life. Take chances in life, do things that you think you could never do, and never listen to the people who are saying you, girl, you can't do that, you're too old.
So they tell you, oh, you need to retire, right?
Right, that's right, but keep it going. And I want everybody to see my New Attitude video. It's all about yourboom.com to see how it affects you when you don't know it. I had singers pretending I had them singing for me, but after they finished, I played a tape and let them hear themselves coughing. They weren't really coughing, but they could have been.
I'm so excited. I mean, just to sing one note in front of Patty, it's just like, I'm done. That's it. I'm good. Hi, Patty.
Hi, sweetie.
I am such a big fan of yours.
Thank you very much.
Wow.
Well, right now, girl, you better sing. Terry, cue it up, baby.
What the singers didn't know is the recording was rigged before they came in with coughing, like they had pneumococcal pneumonia, a potentially serious but vaccine-preventable disease.
To my shoes, know where I'm going and I know what to do. I tidy up my point of view.
I'm in control of my ways of you, 'cause I got love like I never knew.
Then the jokester Patty let the singers in on the prank.
I'm feeling good from my head to my shoes. Know where I'm going and I know.
It's like you never know if you have pneumococcal pneumonia, and you never think because you're over 65 that you can be vaccinated. So please go to allaboutyourboom.com.
Wow, you ladies are fabulous. Great way to kick off the weekend. Dr. Snow, what other resources do you have for our viewers?
For more information, you can go to allaboutyourboom.com or cdc.gov.
Thank you, ladies, for joining us this morning to create awareness of the risks of pneumococcal pneumonia. Bye, ladies.
Bye, Lee.
Bye-bye.
Okay.
Life is full of healthcare challenges that start at an early age. So it's important for all of us to take on a proactive approach to educate ourselves by exploring healthcare options to achieve a greater quality of life. Staying active is the key to longevity. Like Patti LaBelle, who loves working hard and inspiring others to take care of themselves, while enjoying life to maintain a new attitude. Share with us how you inspire others to enhance their lives to take on a new attitude at facebook.com/Rose Lee Show. And follow us on Instagram at The Rose Lee Show. And watch us each week on Discovery Life or 24/7 at RoselyArcherShow.com. Thanks for joining us, and we look forward to seeing you soon. The proceeding was a presentation for The Rose Lee Show. The views and opinions expressed in this program are not necessarily those of this station.